South Africa is in its peak malaria season, but many malaria cases are being misdiagnosed as COVID-19. And that's because malaria and COVID-19 have similar non-specific early symptoms. Those include fever, chills, headaches, fatigue, and muscle pain. Undiagnosed and untreated, malaria rapidly progresses to severe illness with a potentially fatal outcome. Angelo Coppola has the story.
Malaria has been on the decline for the past 2 years due to those COVID-19 travel restrictions. That's all changing now.
But with the rains reduction in travel restrictions, we find people are traveling a lot more, going to malaria endemic areas, and we're seeing cases go up. And added to the cases going up, what we have noticed is that there have been quite a few increases in cases in severe malaria, first of all. And then in the endemic areas, more concerningly, quite a few deaths have been reported. And when we do the investigation into both the severe malaria as well as the deaths, what we are noticing is that it's either very late diagnosis or misdiagnosis at the initial stages.
Mozambique, Zimbabwe, Botswana and Eswatini have been identified as the high-risk neighbours. South African provinces bordering those countries are also at risk. And that includes Limpopo, northern KwaZulu-Natal and Mpumalanga.
You know, obviously mosquitoes don't observe any borders, and so they can move. And what we have found, and it's something that's been reported for years, and it's called, sometimes you can hear it as airport malaria. So mosquito would be traveling caught in a bag, or in South Africa or in Africa, what we find is the mosquito gets caught in a truck or in a taxi that is crossing borders, and it will come from an endemic area, move into a most likely a non-endemic area, and then when it gets released, it's going to be really hungry, and it's going to bite the first person that it sees.
Healthcare professionals have an important role to play in malaria detection.
In the case of taxi malaria, if they see the patient getting progressively sicker and they can't diagnose anything else, just do a malaria test. So we definitely want people to do a malaria test if they've been in an endemic area and start treatment as soon as possible. And what we do want the patients to do, if they started treatment, to finish the course completely.
According to the WHO's latest World Malaria Report, there were an estimated 627,000 malaria deaths worldwide in 2020. Sub-Saharan Africa accounted for 96% of those deaths, and about 80% of those deaths are among children under 5. I'm Angelo Coppola for CGTN in Johannesburg, South Africa.